Hello guys, this is me Dr. Kashan Qasit. Today here we were discussing about the ECGs. In previous lecture we have discussed the QRS complex, abnormalities of the QRS complex, in which we have discussed the narrow and broad QRS complexes. We have discussed also the causes for this narrow and broad QRS complexes. So today we are going to discuss the most important point and most important ECG, which is the myocardial infarction. Myocardial infarction ECGs are very important clinically and also in the emergency. So before going to diagnose the myocardial infarction, remember the following points in mind. Number one, which is the criteria of infarction. Second is the site of infarction. Site of infarction can be anterior, posterior, inferior, lateral or true posterior wall MI. So whatever the site is, you can get a clear view after looking at the ECG. Third point here is the recent or old MI. And finally, you have to keep in mind either the ECG is showing ST elevation or ST depression. ST elevated MI or non-ST elevated MI can also be seen daily basis on the ECG in the emergency condition or in the ER. Now let's begin with the first one, which is the ECG criteria of acute myocardial infarction in a fully evolved case. Fully evolved case means all the layers of the myocardium are involved in this case. In fully evolved case, you will see there will be ST segment elevation on the ECG. The second thing here is the pathological Q wave will be seen. T wave inversion will also be seen, which is also showing here in this ECG. Now I am going to display here some of the ECGs so that you will get a clear picture or concept of this myocardial infarction ECGs. So here are some of the ECGs of myocardial infarction. Now you have seen the ECGs in which you have seen the Q wave, ST segment elevations, the T waves on the ECGs. So the Q wave in the ECG is actually showing the myocardial necrosis, and the second thing, ST segment elevation, is due to the myocardial injury, and the third wave is the T wave, is telling us the ischemia of the part of the heart. Now moving next to the ECG criteria in acute myocardial infarction in the ST elevated MI. In acute STEMI, obviously in this case there will be clear ST segment elevation in the ECG. As in this case of the ECG, you will see clear ST segment elevations. Now we are going to discuss here ECG of hyperacute MI. The hyperacute MI ECG is showing some changes which are within the first few minutes. What you will see in this case is number one, which is the ST segment elevation. Second thing you will notice is the T wave, which is tall, pointed, upright and wide. Then the third thing which you will see is R wave, which has increased in amplitude. Q wave, which also been absent. There can be also possibility of Q wave which will be seen in the recent or old MI, which we have discussed earlier. So Q wave will be absent in this hyperacute MI. So these are the changes you will notice in hyperacute MI. Now look at this tall T wave, which I have already discussed earlier, that it is due to necrosis of myocardium. Potassium is released, which causes the localized hyperkalemia. This will lead to the tall T wave formation. Now question here is that what is the difference in the tall T wave seen in hyperacute MI and the tall T wave seen in the end stage renal disease? So basic difference is that in the end stage renal disease there is an increased potassium level, and the T wave in this case is a narrow, tall, tented, symmetrical, peaked, while in MI the T wave will be broad, not tented, and this will be asymmetrical. Similarly, tall T wave is also seen in parenchymal angina, but don't confuse it with the hyperacute MI, because in parenchymal angina, when we take a serial ECGs, there will be the fall down of T wave. Q wave will never appear again and the enzyme will not be raised. So until now we have discussed the different ECG patterns and we have got some clear picture regarding the MI. And I hope you have got my point. Now there is also ECG criteria for old MI. Old or recent MI also have a criteria. In this case you will notice number one thing, which is the important point here, is the pathological Q wave. The pathological Q wave will always be seen in the old MI. So first one here is the pathological Q wave. Second is the ST segment will be in the baseline, and the T wave will be normal, or there can be also possibility that it can be inverted. This is the ECG of a patient which is having the history of old MI. Now look at this ECG of a patient having the history of old MI. So all the changes I have discussed earlier are seen in this old MI ECG. Now finally, we are going to end our lectures on this final ECG, which is the ECG in case of non-ST elevated MI. So the changes which will be seen in the non-ST elevated MI, as the name is showing, there will be no ST segment elevation, but ST segment depression can be seen. There can also be a possibility, second possibility, T wave will be absent, and there can also be a possibility of T wave in this case, which will be deeply inverted, and usually it will be symmetrical. So until now we have discussed all the different cases of myocardial infarctions, and we have seen different ECGs with the different patterns. So this was all about today. In the next video we will discuss some other important ECGs, so stay tuned for the next videos. Hope you like my video. Thank you very much for watching. I'll see you in my next video.